as you have heard in the cancer prostate session, same is about the renal cell carcinoma. And as you know, the non-metastatic, the surgical treatment is the first option. But for metastatic, there is definitely the role of immunotherapy is coming up in a big way. And now this combination of immunotherapy and radiotherapy. So these are, I would say, in the trial setting at the moment. And clinical practice, I don't know amongst the audience who is doing this kind of treatment. Regarding the surveillance in renal transplant recipients, I think so. Ultrasound is very commonly available, and like a annual health checkup, ultrasound should be done in a post transplant patient. And I think so in India that kind of study is not a problem actually. That is a routine practice.
Couple of comments, as Dr. Gupta has clearly said, what is, and I endorse what his views are. Now, of late I'm seeing patients at Bombay Hospital where the transplant program is going on for the last 30 years. And in last 3 years, I have seen patients who had recipients, I mean, more than 15 years, 3 renal tumors in, these native kidneys. In other words, why it was not there before? Because the transplant, recipients are not surviving. As they are surviving more, this is as far as the RCC is concerned. There are other recipients who are also developing prostate cancer, lung cancer, and so many things. So it's going to be there. And I think with the transplant program, which is going on so well across the country, and now we are finding these patients, so we'll have to be more vigilant. And we will have to look into not only ultrasound, but something more than that, because the patients are going to live longer. So that's one take I got. The other thing which, of course, we looked at the cytoreductive nephrectomy. The debate is going on and on. Well, thank you very much for this new abstract which says there is a role for cytoreductive nephrectomy. We are reanalyzing and reinventing those things, that there is a place for cytoreductive nephrectomy. Having said that, oligometastatic, bone-only radiation. Again, the radiation was never used as a primary therapy. It is always for pain relief. So I think the articles also clearly mention that the primary treatment plus, and as the immunotherapy is going to be the answer. Slowly, I don't know, Dr. Gupta was saying that we might have not to do any nephrectomy either. So maybe the times have come where we'll have to look into these things. Thank you very much, and very good session, and very good selection of papers. The honesty of the people was good, in the sense those who were reported, especially if you see this article on, nephrometry, nephro score, 24%, as I saw, were converted into open surgeries. Honestly, I think that's very nice. Thank you very much.